Hello, my name is Beneath Amba, and I'm a third-year medical student at Rutgers Robert Wood Johnson Medical School, representing the HEAL team. HEAL stands for Hypertension, Education and Lifestyle Modifications Initiative, and together we, with Dr. Lillian Saro-Nunez, who is a nephrologist at Robert Wood Johnson University Hospital, are hoping to deliver a series of presentations and modules to the Middlesex County community to help those who might be seeking some extra help with controlling their hypertension or just wanting to learn more about hypertension management in general, whether it be for their personal learning or whether it be to take care of family or friends. So today I'm just going to be giving a brief overview of hypertension and a brief overview of our program. And this presentation was actually delivered on February 5th, and this will be available for your reference on the East Brunswick Public Library website. So just to take you through the table of contents, first we'll be going into what is hypertension. Next, why is hypertension a bad thing? Next, what can we do about hypertension? And finally, how can we at the HEAL team help you? So first of all, just to put this out there, for the purposes of this presentation, high blood pressure is hypertension. And to better understand how to manage hypertension, it's important to understand what is blood pressure at a baseline. So if you go to the top left corner of the screen, what is blood pressure? When the heart pumps blood through the arteries in your body, the blood naturally puts pressure on the walls of your artery, and this is known as blood pressure. When you start thinking about hypertension, that means that this pressure that's being put on those artery walls is actually rising sometimes to an unhealthy level. And if you take a look on the right-hand side of the screen, the American Heart Association actually has an excellent table that you can reference on their website as well, and that many clinicians reference, to show the different stages of hypertension and different stages of blood pressure. And finally, if you refer to the bottom left-hand corner of the screen, where and how do I take a blood pressure? We'll be going through a lot of these tools and resources throughout the course of our presentation. But we just wanted to let you know that we do have a list of resources around the East Brunswick and Middlesex County community of where you can take a blood pressure for free. And you don't even have to visit your physician office to do so. Next, let's just go into the definition really briefly. Hypertension is a condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause heart issues and widespread disease. And I know that's very technical, but we'll be diving into that a little bit more throughout this presentation. And just some statistics to throw at you. Who has hypertension today? Approximately 1 in 3 Middlesex County residents. 41.5% of adults between the ages of 50 to 64 years in the United States, and 61.9% of adults aged 65 years and older in the US. So next, going into why is hypertension bad? Why is it a problem? It's especially a problem now because blood pressure management became drastically worse during the COVID-19 pandemic. And that's due to issues with getting in touch with physicians and other providers. A lot of the tools you might have used to manage high blood pressure might have become harder to obtain. Some of the lifestyle modifications you might have been making may have become harder, like getting fresh foods and exercising regularly when COVID was widespread. And on the other side, hypertension is a risk factor for COVID-19 complications as well. Apart from the COVID-19 discussion, chronic uncontrolled hypertension can cause widespread disease throughout your body. So in the heart, you might see heart failure, heart attack, coronary artery disease. In the kidney, you might see kidney failure. In the brain, you might see dementia or cognitive impairment throughout the lifespan. And other system-wide results of chronic uncontrolled hypertension could include sexual dysfunction, vision impairment, and even peripheral artery disease. So I know I just shared a lot of statistics, shared a lot of the bad news with hypertension. Now I just want to take you to some of the good news. So as you can see on the left, we have some risk factors for hypertension that you might have actually read about at a provider's office or through your own reading. Family history, older age, men under 65 years of age, and women 65 years of age and older. race, and having chronic kidney disease are all risk factors for hypertension. But the good news is there are plenty of modifiable risk factors that we can work on together to actually bring your hypertension down, your blood pressure down, to a more manageable level. These include diet, sodium intake, physical activity, stress, weight, alcohol consumption, sleep habits, and smoking and tobacco usage, amongst others. And especially these 8 we'll be talking a lot more on throughout the course of the program. So finally, taking us to our last slide. As I said before, HEAL stands for Hypertension, Education and Lifestyle Modifications Initiative. And we have 3 goals. The first being to empower the hypertensive community members to meet their own goals, to improve health literacy around hypertension control and management, and create a platform to promote longitudinal hypertension awareness and management. And with those 3 goals, we have 3 initiatives. First, in-person and online educational sessions discussing modifiable risk factors, online modules that cover basics around hypertension management and care, like this one you're watching right now, and a longitudinal buddy system to support community members that want more support with hypertension management. And we will have more information on that buddy system on the East Brunswick Public Library website, and we're happy to discuss this in more depth with you whenever you would like. So thank you for listening to this first module. You can contact this email on the screen if you have any questions. We also have a QR code at the top of the screen that you can scan using your phone's camera to directly go on the website and have access to all the resources you might want to look through. Thank you for listening.